We're going to continue to air the weight loss industry's dirty laundry because people need to know what's happening and they deserve to be exposed.
Welcome to the Exposing Obesity Incorporated podcast.
This is episode 1, Pilfering Purdue's Playbook.
I'm Louise Adams.
And I'm Ragen Chastain.
And we are exposing the seedy underbelly of the weight loss industry.
Now, we know that the word obesity is stigmatizing and harmful, but we're also trying to expose the industry that was created based on the construct of, quote, obesity, which is why we use the word in the podcast name. During the podcast, we do our best to avoid the term. When we do use it, we'll use, quote, obesity or Louise's brilliant invention, oh, pleasity, with an eye roll always implied. And when we write it, we use the asterisk instead of the E.
Absolutely. We are so excited for this first episode and we can't wait to bring you just so much trash from the weight loss industry. It's not even funny. But before we get into things, thank you, first of all, for joining us and listening, and make sure that you're subscribed so you don't miss the podcast episodes. We're aiming to have them out to you every fortnight from now on. And if you're feeling really, really generous, throw us a kind rating and a review and tell everyone you know. Help us spread the word about what we're trying to do here. And you can follow us on Instagram as well at Exposing Obesity Incorporated. So we're going to talk a little bit about the inspiration for our show name, which is Exposing Obesity or Obesity Incorporated. We just wanted to do a thank you once again. We did it in our intro, but Alicia Mundy, whose book Dispensing with the Truth took us inside the scandalous behaviour of the weight loss industry during the fen-phen craze in the 1990s. Alicia coined the fabulous and extremely accurate phrase Obesity Inc. to describe the interconnected network of obesity researchers, pharmaceutical companies, and health professionals all working together to prop up the weight loss industry. And so I wanted to start the show by a bit of a review of the fen-phen disaster and the lessons that were not learned from it, obviously, because it really does expose the sausage factory of obesity research and pharmaceutical industry and health professionals profiting off all of this. So back in September 1997, two really popular weight loss drugs, Fenfluramine and dexfenfluramine, were removed from the US market because they were causing heart defects. And for the past 5 years, so throughout the 1990s in the US, the fen-phen craze had clutched the entire population. 7 million Americans were taking it. And the lethal impact of fen-phen was pretty horrendous. But the antics behind the scenes of Obesity Incorporated was even worse. So what was fen-phen anyway? It was actually two old weight loss drugs, phentermine, which was an amphetamine, and fenfluramine, which acted on serotonin receptors in the brain. Neither of these drugs were very effective in terms of causing weight loss, and fenfluramine in particular just tended to make people very sleepy. And when it first applied to the FDA for regulatory approval, fenfluramine was actually knocked back in 1969. At that point, it was being marketed under the name Pondamine, and the drug company, A.H. Robbins, complained to the FDA because they said that the evaluator was being unfair for knocking back their drug, even though it was ineffective. The FDA then awarded them a new evaluator and it passed for short-term use in 1973. And the person who was responsible for this change in evaluator ended up then going and working as a rep for weight loss companies. There's a little bit of a revolving door that tends to happen between the weight loss industry and the regulators that are supposed to be protecting human health. So after that, in the 1980s, a researcher called Michael Weinbaum, he was at the University of Rochester in New York. He had a little bit of a brainwave. What if you mix two weight loss drugs that are not very effective together and see what happens? Because maybe phentermine, which is like the speed part, could offset the sleepiness of the fenfluramine. So he cobbled together a government grant and he ran a small study which ran over 4 years between 1983 and 1986. There was 140 people. Most of them were women. There's another theme in weight loss research. Most of them were white. There's another theme in weight loss research. And the paper claimed there was a 16% weight loss by 34 weeks. And this was kind of unprecedented in weight loss research, which had hardly ever nudged anything above 3 or 4% in terms of absolute weight loss. And suspiciously, it was a result that was never replicated subsequently. Weintraub's paper reported almost no negative side effects. And later on, he told the New York Times, I figured, gee whiz, these drugs have been on the market for like 10 or 12 years. We must know everything about them. I'm hearing that now. I don't know about you.
Oh my gosh, yes. We have so much research, but it's not on actually what they're doing or what they're prescribing to people, but like close enough. I think too about the way that they accepted short-term use approval. Like they're
Yes.
trying to say this is lifelong weight loss. They know people gain the weight back as soon as they go off the drug, but yet the FDA was like, no, we'll approve it for short-term use. Like, to what end?
Yes, well, to the end of the profits of the weight loss company. So, this glowingly positive 4 year long research paper was apparently sponsored with a government grant. But Alicia Mundy's brilliant book uncovered that Weintraub actually wrote a thank you note to the drug company A.H. Robbins, saying he couldn't have done it without them because there wasn't enough funding that came from the government. This fact didn't get disclosed in his subsequent publication. And the interesting thing there was that the paper didn't even come out until 1992. So that's 6 years after the research is done. Coincidentally, by that time, A.H. Robbins had been bought out by another drug company called Wyeth under the umbrella of a really big conglomerate called American Home Products. And of course, big companies don't buy little companies without a profit in mind. And so soon after the takeover, Weintraub's study was published as 8 separate articles in a supplementary journal. And when things in academia are a supplementary journal, it means someone has paid for it. Alicia's book detailed that Weintraub told the journal at the time that the government grant would pay for the supplement. But Alicia, God bless her, went and checked it out, and that wasn't the case at all. So the government said, no, we did not pay for that. The grant had ended by 1986. And eventually, Weintraub admitted through his lawyers that he had received money from industry to publish the supplement. But sadly, he developed a case of amnesia because he couldn't remember who had given him the money or how much.
Can you imagine when we say the weight loss industry is lying to us? We don't mean like just us, like they're lying to everybody all the time.
It's wild. So the paper comes out in 1992 and it kicks off this Fenphen frenzy. It was just a massive cash cow for Wyeth and for AHP. In between 1993 and 1996, their sales soared from $3.7 million to $150 million. Staggering.
That kind
So
of money will pay for a lot of supplemental journal publication.
oh, I'm not even getting warmed up. It gets so much worse than this. But yeah, we're getting an idea of just how much money is at stake when it comes to the promised land of a weight loss drug. So, seeing dollar signs in his eyes, an MIT scientist, Richard Wertman, pioneered dexfenfluramine, a newer version of fenfluramine, but without the drowsiness. American Home Products then bought his company. And so the only thing left to do was to get FDA approval for dexfenfluramine. And now Wyeth owned both Pondamine and dexfenfluramine, which was going to be marketed as Redux. As Wyeth were gearing up to get that approval across the line, there was some real trouble brewing. There was a growing number of cases of primary pulmonary hypertension, or PPH, in young women all throughout Europe who were taking these drugs. PPH is a rare but very lethal lung condition that can lead to heart failure. In 1995, the International PPH study found that the use of these drugs was hugely increasing risk. By June 1995, almost no one was using it over in Europe. Back in America, which only had Pondamine FDA approval, the risk of PPH was listed on their bottles, but it was listed as a very rare side effect. But again, Alicia's book showed that internal documents had massive amounts of information about just how common this actually was, and they were deliberately concealing it from the public. It's just shocking.
Shocking. And remember this because this is going to keep coming up. This is a cycle and a playbook that they have been using and continue to use.
Sadly, yes. And now we move on to the actual FDA approval process, which of course was all above board and nothing went wrong, except that's not what happened.
I am shocked, Louise. Tell me more.
Well, so September 1995, Wyeth arrives for their FDA approval meeting with a huge posse of obesity researchers, and they're the all stars of the industry. They're all there as paid consultants for Wyeth, and their aim was singular to persuade the FDA that being larger bodied itself was such a deadly killer that a small increase in pph was pretty acceptable in the grand scheme of things. There was Joanne Manson from Harvard University, who earlier that month had released a very big article claiming that obesity was killing 300,000 Americans every year. So the benefits way outweighed any kind of concerns about health. But what about those benefits? So originally, the FDA said that in order for Redux to get across the line, they'd have to prove an average weight loss of 10%, but they couldn't quite get there. So the FDA agreed that they could drop that to 5% average weight loss. Then they couldn't actually show that either. So the bar went down even more, and I think it ended up something like 3%. It was quite literally embarrassing. There were whistleblowers that showed up at this FDA meeting who valiantly tried to raise the alarm, and the IPPH study author was one of them. There were also toxicologists there because it wasn't just PPH that was of a concern. In animal studies, they were finding what looked like tangled plaque in the brains of animals that had been exposed to this drug. They were concerned about neurotoxicity. There was an awesome fat activist at the FDA meeting, Lynn McAfee, and she
Go
famously
in.
said, "I don't like tangles in my hair, let alone my brain." We need these whistleblowers because it's never the industry that calls itself to attention. It's always whistleblowers. And it did seem at the FDA meeting that things were going kind of well. They voted against Redux 5-3. But then very soon afterwards, a second meeting was arranged. And at a time when the two toxicologists would conveniently be away at a conference and couldn't attend the meeting. What a coincidence.
Amazing.
Uh-huh. So the meeting happened in November and there were more people. There was 11. And there was obviously some enthusiastic Redux supporters because it got across the line with a vote of 6-5. And, that really sadly signed the death sentences for an untold number of people because pandemonium ensued, right? In our culture, if there is a weight loss pill, there is demand. There were 18 million scripts written in 1996 alone. And as I said at the introduction, like 7 million people were taking this drug by the time problems started popping up, which was not long. So there were fen-phen pill mills that were popping up in shopping malls. Doctors were coming out of retirement to start selling prescription drugs by any means possible. Does that sound familiar? And even the big commercial weight loss companies like Jenny Craig and Weight Watchers started peddling Fenphen.
Familiar.
I know, I know. It's like everyone gets on board. And Wyeth, of course, weren't shy. They were launching a massive PR program. They spent more than $50 million advertising their products. And their generosity found its way into the pockets of numerous professional organizations, including the American Diabetes Association, the American Academy of Family Physicians, the always helpful American Association for the Study of Obesity, ASO. I like to call them ASOs, and the American Society of Bariatric Surgeons. So everyone was just riding high with all of this cash. Really concerning stuff started to happen. Attempts by the IPPH authors to raise the alarm were squished and in dodgy and frightening ways. Stuart Rich, who was one of the co-authors, he went on the Today Show to talk about his concerns, and he said that the most popular diet drugs in American history were actually killers and spoke spoke about the risk of PPH and what was going on in Europe. After he appeared on the Today Show, he got a threatening phone call from Dr. Mark Deet, the medical director at Wyeth. He told Alicia Mundy it was frightening. He wouldn't even tell her what was said in the phone call. But after that, he cancelled all of his other planned media appearances. So dissension was squashed, not just publicly, but behind the scenes. In the same journal where the IPPH study was printed, a really glowing editorial about Redux appeared, written by none other than Joanne Manson from Harvard Medical School and some of her cronies. And of course, that was concluding that the benefit far outweighed the risk because, of course, we get back to that. 300,000 people are dying of obesity every single year. And of course, the editorial neglected to add that they were being paid by Wyeth or that they'd gone to the FDA to lobby in favour of the approval. So it's a
Just a
complete.
lady who wanted to write an editorial. No reason, it just like struck her that she maybe should write something up. Absolutely no conflicts of interest there.
It's just so bold and so blatant. I've been looking at this for so many years and I still get shocked when I even talk about it in great detail because there's just so many decisions here that go beyond a conflict of interest. Like this is a deliberate attempt to downplay real risk.
Yeah, and nothing like the threaten people who disagree with you part of the scientific method. Like, what are we doing?
Threatening phone calls. Oh my
Good
God.
grief.
I know. It's like, the godfather of obesity. It's wild. Anyway, so the end of Fenphen didn't end up happening because of neurotoxicity or PPH. A few months after the approval, researchers at the Mayo Clinic were finding people were reporting heart valve defects and 24 women were identified. So the FDA sent out a public appeal to report in their cases. By September 1997, there were 144 cases, and it was really quickly pulled off the market at that point. I think at the end of the day, it was found that up to a 1/3 of users were developing severe heart problems after taking, even for a short period of time, this drug. But of course, instead of concern for citizens and health, Obesity Incorporated lamented the loss of their cash cow. So get this, at MIT, Richard Wortman was so mad about his stock losses that he wrote a really paranoid email in a fit of rage to a fellow pharmaceutical CEO. And I'm going to quote it. He says, "Now everything is clear. The coordinated attack on Redux during the past few weeks is part of a conspiracy led by fat women to make everyone fat by taking away the only medications to keep people from becoming so."
Wow. Wow, on like 10 different levels. Wow, that is special.
I mean, that's the obvious conclusion, right?
I mean, what
What
else
else?
could like people are dropping dead, but like, I mean, it's the fat women. They just want everybody to be fat and our drug is fine except for all the people dropping dead. But like other than that,
I mean, you've
good
got to
lord.
take it to the logical conclusion. They're like, what is he saying? Like, fat people are going out and causing heart problems in people? I
Yeah.
don't understand.
Yeah. How did they do it? Do tell.
Not his best moment. The true number of deaths from Fenphen, we don't really know, but from FOI documents that were revealed again by an undercover journalist, not publicly disclosed, that there'd been 70 reported deaths between 1974 and 1997 to the FDA. Wyeth got in lots of trouble and they ended up having to put aside $22 billion to pay damages to 600,000 people. There was hundreds and thousands of lawsuits happening. The Fenphen debacle made no sense from any kind of scientific perspective, but everything makes sense when you follow the money. After this whole kind of calamity, the obesity research field had a reputation that was similar to a blocked toilet, and no new weight loss drugs were approved by the FDA for a glorious period between 1999 and 2012 that everyone was very, very leery. Of course, nothing like this would happen at a pharma company that treated real diseases, like Novo Nordisk, the Danish pharmaceutical company, which had built its whole empire on producing insulin to treat the dreadful disease of diabetes, Novo worked really hard to cultivate a reputation as one of the world's most ethical pharmaceutical companies. In 2010, it even partnered with the University of Copenhagen to launch an online ethics tool to help businesses navigate ethical grey areas and make morally sound decisions. Why are you laughing?
I'm just like, did they look at it ever? Or was this ghost written? I can't imagine how this worked out.
Kind of wild. The launch of the tool came at a very interesting time because just weeks earlier, Novo had taken their insulin pens off the market in Greece at the height of the country's debt crisis, prompting accusations of being brutal blackmailers from the Greek government. The fact was, Novo's CEO, Lars Sorensen, was hell-bent on expanding their market share, particularly in the very, very lucrative US market. Novo's not-so-ethical path to massive profits featured dodgy marketing, reducing diagnostic thresholds, and jacking up prices. During the 2000s, Novo invested about $500,000 and they expanded their US sales force from 80 people to 2,000 and used sales reps to position the company to aggressively market their ever-expanding range of new and designer insulins. Many of them offered no real benefit from older or cheaper versions. A lawsuit later revealed that during this early 2000s time, Novo were running what they call a white coat marketing program. About 60 nurses and dietitians who were called certified diabetes educators were trained at Novo's sales division and then sent out into medical clinics under the guise of independent diabetes education. But internally, the objective was pretty simple. The mantra was insulin sooner, insulin earlier. One of the educators involved in the whistleblowing case estimated that about 75% of previously unmedicated patients were started on Novo's insulin following these education sessions. Novo also invested heavily in influencing diabetes organisations to expand the market. They promoted very strict reductions in blood sugar level targets for people who already had type 2 diabetes, despite experts warning that really low HbA1c thresholds could encourage overtreatment, risk hypoglycemic episodes, and even death. The ADA's, the American Diabetes Association's new target of HbA1c below 7% became a national performance measure. That vastly increased the number of people who would be taking Novo's medications. Then there was a masterstroke, a PR-driven rebrand of people who had maybe slightly raised blood sugar but weren't actually sick. The American Diabetes Association introduced the label of pre-diabetes, and that added another 72 million American people suddenly needing monitoring and even medication. All of this happened during a period where Novo was basically jacking up the prices of their existing products. Usually, the longer a product is on the market, the cheaper it gets. The opposite happened in diabetes medication, particularly in America. Between 2000 and 2015, their price for Novolog, their fast-acting insulin, increased by over 600%. By the mid-2010s, Novo Nordisk, Eli Lilly, and Sanofi controlled 90% of the US insulin market, and insulin prices in America soared up to 8 or 10 times higher than they were in the rest of the world. As costs went up, patients began rationing their medications and taking big risks like skipping doses just to afford a drug that they really did need in order to stay alive. By 2016, the situation was pretty dire, actually, for Novo. Even politicians from all sides of the political spectrum were calling them out. Bernie Sanders was saying that they're just profiteering, and even Donald Trump was claiming that the drug companies to do with diabetes were getting away with murder. There was looming price controls, and suddenly regulatory scrutiny was actually happening, threatening Novo's business model, which had just printed money for them for decades. And so what did they do next?
Well, thank you for asking. We know exactly what they did because they absolutely told us. Novo Nordisk CEO CEO said it out of his own face hole. So at this point, Novo had started to have these GLP-1s for type 2 diabetes, and these drugs had a side effect of weight loss. And so the Novo Nordisk CEO said to their shareholders, we are making a bet on obesity and we will create the market. And I think something Louise said to me was, you don't have to create the market for Ebola. You don't create the market for actual health issues. You create the market when you're creating the health issue. And so one of the things we have to understand is that these are publicly traded companies. Their fiduciary responsibility is to their shareholders, not to the people who take their drugs. So to them, the patients are the profit center. The patients are the backs upon which they build these massive profits. They knew how to create the market because they had 3 strong playbooks to draw from. And the first of those was the weight loss industry's own playbook. And Louise talked a bit about this. The weight loss industry had spent decades demonizing and pathologizing bodies based on very shaky science, creating weight stigma, and then marketing their product as the solution to the problem that they themselves created. And a lot of this had to do with creating mountains of poor research that connected weight to health issues. One of the main ways they did this was by ignoring confounding variables. We know that weight cycling, weight stigma, and healthcare inequalities are independently linked to the exact same health issues that get blamed on body size. And they put out all of these studies and they would not mention, let alone control for, weight stigma, weight cycling, or healthcare inequalities. And they would say, oh, see, we've got all of these correlations between weight and health. Obviously, higher weight causes health issues. And so that's why it's worth risking higher weight people's lives and quality of life in efforts to make them thin. That's been and continues to be successful with the FDA, this idea that being fat is so dangerous that it's worth risking people's lives and quality of life in attempts to make them even just a little bit thinner. And so that was the playbook that the weight loss industry had been running for years. And they had reached an expert level at this. To this day, the manipulation of that construct they created of obesity creates an ever-expanding market and profit base for them. So they started generally saying that higher weight bodies were unhealthy, were dangerous. And then earlier in the game, they realized they needed concepts, they needed terms, and that's where we get, quote, obesity, which comes from a Latin root that just means to eat yourself fat. So a lot more stereotype than science there. And then there's overweight, which is just an unscientific body shaming term, but they managed to get these into the lexicon, into science, into guidelines, in many ways using these paid relationships that they had with organizations like the American Diabetes Association. And so the weight loss industry had become a machine for profit in this way. And one of the big things that they used to create that profit was a repeat business model. They were well aware that once people lose some weight, their bodies respond by essentially turning on all of the survival mechanisms that bodies have for famine. So people lose weight short term, and then their bodies change physiologically to become weight regaining, weight maintaining machines, and then they gain the weight back. The weight loss industry knew that from the beginning, and it was not a barrier to them because they just used that repeat business model and they blamed fat people for not being successful at these interventions when in fact the interventions were failures, and that was known among the weight loss industry the whole time. So that's the first playbook that Novo Nordisk had to draw from. The second playbook they had to draw from came from Purdue Pharma. Purdue Pharma was the company that created and marketed OxyContin. They had created a clear roadmap and blueprint to do that. It involved establishing pain as a vital sign, as a health condition that required long-term treatment, and then expanding the types of pain that were to be treated to expand the market. And does this sound familiar? Because it feels like Louise just said this, right?
Yeah.
I know, it's so odd. You can rewind. I think she just did. So then they influenced guidelines and research. They did that through organizations that were existing, but they also created their own organizations. So they would create these so-called patient organizations that were funded by and acted as a lobbying arm for the drug companies to pressure at the physician level, at the government and legislative and policy levels, more approvals for these drugs, for higher levels of these drugs, for expanded unfounded diagnoses for these drugs. And then they claimed that any pushback was actually stigma and that opioids had a stigma that must be overcome. So anything that questioned the safety or the wisdom of prescribing opioids at ever increasing doses to an ever expanding market of people was simply labeled as stigma that must be overcome. And highly recommend the book Empire of Pain by Patrick Radden Keefe. He digs way into the Sackler family who created Purdue Pharma and created this roadmap to create a blockbuster drug that has turned into an absolute crisis.
And also a training manual for what's going on right now.
Exactly. So these blueprints, Novo Nordisk looked at what had happened and realized they had the information already. And so we've got the weight loss industry playbook, the Purdue Pharma playbook, and then we come to the insulin playbook. And Louise spoke a bit about this. The creators of insulin created it after watching kids with type 1 diabetes die. And once they figured out, they cracked the code on insulin, it was incredibly important to them that anyone who needed insulin have it available and accessible to them. And for that reason, the patent for insulin was sold to the University of Toronto for $1 to make sure that everyone who needed insulin could access insulin. And then Novo and Lilly and Sanofi took this drug that they did not have to do a ton of from scratch development on, that cost about $2 per vial to produce. And they sold it for up to $300 per vial in the US. And the US, of course, does not have governmental price controls, so they can sell it for whatever the market will bear. And so they just kept increasing and increasing and increasing the price, and as Louise said, they weren't really improving the drug. They were just creating a more expensive drug and a bigger barrier to entry for care. It's important to understand people died because they could not access insulin. They couldn't afford it, even though the creators had very specifically not taken a bunch of money for the patent so that that would never, ever happen. And so the way that I interpret that is that Novo Nordisk and Eli Lilly, who are the two current GLP-1 weight loss manufacturers, are also two companies who have made it abundantly clear that they will kill people for profit. They will let people die for profit, and they won't stop until someone makes them stop. If the US had not been coming in and saying there were going to be price controls, and man, when Donald Trump says that you're dangerous and a fraud, like, wow, hello pot, kettle, but still, like, that was incredibly clear. They won't stop until someone makes them stop. And I think everything they do has to be viewed through that lens. So as we go through this first season where we're going behind the scenes and setting the scene, we're going to build the scaffolding on which we're going to be able to pin the other information and stories and behind the scenes and dirt that we have on the weight loss industry. It's important to always remember that these are two companies who knew people were dying because they couldn't afford the exorbitant, wildly outsized increased price of insulin and did nothing about that. They let people die.
Okay.
I'm the delight at parties, by the way. Call me for your next wedding or event. I am just an absolute laugh riot delight.
Oof, it's a lot to absorb, isn't it?
It is. It's like you said, you and I have both been doing this for over 20 years, and it still makes me so angry to hear these things. Unfortunately, it's not surprising to me, but it's still shocking to me that this has happened and that it continues to happen. So if you're listening to this and you're feeling overwhelmed or you're feeling hopeless or helpless, I really want you to understand people have been pushing back against this successfully for years. Lynn McAfee is a beautiful example of that. And people will continue to push back. We're going to fight. We're going to win. And we're going to talk to you in this podcast about things that you can do to push back. And this podcast is actually part of that, right? That we wanted to get this news and this information out there to a lot of different audiences. And that is why it's so amazing that you're here. We're very excited to be talking about this. And we're going to continue to air the weight loss industry's dirty laundry because people need to know what's happening and they deserve to be exposed.
Yes, absolutely. I think we do need to remember that we are living in the age of Ozempic where it can feel very, very overwhelming. But in the story of the past is the story of the bad stuff ending, not because of voluntary decisions on the part of the industry, because of really cool whistleblowers. And Ragen is a really cool whistleblower. I'm a really cool whistleblower. There's hundreds of us, thousands of us, millions of us around the world. One of the things that's going to flush out with all of this is the truth. And I'm just really glad to be here. And I want to say thank you for sitting through this. In our next episode, we're going to keep on going. So we're going to run through Novo Nordisk's 10-year 3-step plan that Novo created and then very much followed through on in their mission to create the market for obesity care. So, if today's episode has got you thinking, got you mad, got you riled up, or got you putting things together in a different way, we just love to hear from you. Do you have insider information about the shenanigans of the weight loss industry? Did you used to work for a pharmaceutical company or Novo or a clinical trial clinic? Have you been involved in a patient advocacy group or a marketing agency? Have you seen something or heard something that we need to know about? You can visit a special portal that we have set up that we are calling Obesity Leaks. So, kind of like WikiLeaks, but for fat scandals and weight loss industry scandals. You can go to speakpipe.com/obesity leaks and leave us a voice message. It's fine if you're anonymous, it's totally free. We just want to hear, and we will absolutely listen to every single message, and we might talk about it on the show. If you're not happy about that, just let us know. If you're looking for resources about the things that we've mentioned today, show notes, a quick link to Obesity Leaks or anything else about us, you can go to Exposing Obesity, or actually, this one, we're going to oh, wait, we don't mean to be so confusing. We're so sorry. Exposingobesityincorporated.com to have a look at all of that stuff.
Finally, if you have questions you'd like to ask, if you have topics you want us to cover, you can always find us at obesityincorporated@gmail.com. Like Louise said, we really want to hear from you, so feel free to reach out.
Yes. Thank you so much for listening. We look forward to seeing you next time.
Bye.